today. Today I've got an interesting topic. I'm going to start a new series. And that new series is going to be taking just some of the patients I see on a day-to-day basis. Obviously, I won't include their names at all. I'll just show you the information that I got and the information I reviewed, and then go over their symptoms, what they experienced, their functional disability, what we saw on imaging, and then which types of CCI they had, what the treatment recommended is, etc. And the goal here is one of the watchers of this show had talked about the concept that many patients are interested in seeing the symptoms associated with various types of craniocervical instability. And so to that end, I thought I'd go even a little deeper than that and share some of the stuff that I look at on a day-to-day basis. Now, today, we're going to go into, in depth, a patient who had an upper cervical chiropractic manipulation. This was not in the US, this was outside the US, and ultimately had a transverse ligament injury, an alar ligament injury, and an injury at C2-3. And then we'll get into what did that patient experience, how functionally disabled were they, what does all that look like, and then how does that map back to the types of CCI they had, and then how does that map back to not only that, but what treatment was appropriate. So as usual, I'll present some slides initially. You can ask questions at any time, and that's just by commenting below and asking a question. And then you can also feel free to ask questions about this topic or really any topic at all. Okay, so let me go ahead and get to the point where I can share my screen here. And then we're going to go to today's discussion. Oops, wrong ones. So again, this is going to be a new series just based on what I've heard patients are looking for. I'm going to present some CCI cases from my day-to-day experience and from my day-to-day practice. And this one's called the head manipulation transverse alar ligament injury. Now, this is a patient who came from outside the US, and because he was coming from outside the US, we had some information, but not enough. So he had to get a digital motion x-ray here in Colorado once he was seen. So this is a patient who came in, was seen, had a DMX, then went ahead and we looked at all this information, we were able to get to a diagnosis and then a treatment plan for this patient. So let's start with his symptoms, because I've heard from some of the listeners that you're really interested in seeing what kind of symptoms might map to what kinds of CCI. So these are his big symptoms: pressure and pain in the head. That's his pain diagram off on the right. Tinnitus and stuffiness in his ears, and visual changes. Now, he had other symptoms as well. Those were just his top three. So the other symptoms were crepitus or cracking in the neck when he moved his head around, dizziness, heart palpitations, unexplained tachycardia, and brain fog. What aggravated things, what made things better? One of the things that is a common refrain in this patient, and that is with a lot of patients with transverse ligament injury, is that neck flexion tends to make things worse. Too much motion of the head and neck tends to make things worse. That's pretty common. Driving, jumping, running, all aggravated this pain in his head. Wearing a cervical collar made it better. Taking a hot shower made it better. Laying down or just decreasing head and neck movement tend to make it better as well. And the cause for all this was an aggressive head rotational chiropractic manipulation. So very different than a NUCA manipulation, very different than a gentle AO manipulation. This was the big head turn like chiropractic. Treatment, Botox was really no help. Chiropractic, acupuncture, PT, massage, no help. His functional level, he wasn't able to exercise or hold the job. And he could do some things if he modified what he did. So he wasn't completely functionally disabled, and he was able to care for himself. So this is the cervical MRI here, and let's just sort of go through here and see what we see. So he's got a couple of cervical disc bulges down here, but none of those disc bulges really correlated with his ongoing issues. So for instance, the main issues weren't numbness and tingling in the arm or hand, which would have been due to these lower cervical disc bulges. He didn't really have too much else. If you look at his ADI, which we later saw was an issue, it's not an issue here at all. He didn't really have a big grab oaks. His clavoaxial angle was normal. He did have atrophy in the upper cervical stabilizing muscles. So ultimately, when he got here and did a digital motion x-ray, we were able to see that there was opening of the ADI. So that's his ADI there. We're still getting the lines that go to the left there. Sorry about that. That has to do with the fact that I've gone to a wider screen, and I think PowerPoint doesn't quite know what to do with that. So that opening of the atlantodental interspace, as we've talked about before, is a CCI type 2A. Then he had, in addition to that, motion forward of C2 on C3, which is shown there. So that's a CCI type 3A. And then the open mouth lateral bending DMX showed problems with the C1 sliding sideways on the C2, or a type 2B CCI.